My name is Shimmy, and welcome to Shim's Gym. Today we're going to be talking about the hip hinge, how to do the movement correctly, common mistakes people make, and cues that you can use in order to do the movement better and to constantly use them and make sure that you're not making any mistakes. So the hip hinge is a movement that uses your hips or your pelvis, and you're going to be, which is the center of your body, and it's going to help you with a lot of key movements to help you be much stronger, such as the deadlift, the squat, the bent over barbell row, and you're just going to get much stronger overall. It's going to work out the posterior chain, which is the back side of your muscles, okay, the glutes, the hamstrings, the back, okay. So we're going to get started. I'm going to go to the side so you can see it much better, the movement pattern much better. So the first mistake people make is they have staggered feet, okay. So people think, well, it's a hip hinge, right? What does that have to do with your feet? It has a ton to do with your feet. If your feet are staggered, you're going to be creating imbalances. You're going to be creating imbalances in strength, and the movement pattern is not going to be correct. Okay? So first thing you do, make sure your feet are shoulder width apart, in line with each other. The next mistake people make is they will bring their head forward or bring their head back when they're going down. So I'll show you. They're going to hinge and they'll be bringing their neck up, or they'll be tucking their neck, which is going to cause a lot of stress on the spine. Okay? Now, the third mistake, which is the most common mistake I see people make, is they use their back and then they don't use their hips at all. What they do is they just come down and they're like, okay, I'm going to lift this weight like this. I'll just pick it up. What's the difference? Pick it up, put it down? No, you're causing a lot of stress on your lower back and you're going to get hurt. A lot of times also people will use their knees instead of their hips. So what we're going to do is make sure your spine is you're going to be in a neutral spine. You're going to be in one straight line. So you bring your head in a straight line, shoulders, your shoulder blades, you're going to think about tucking it back into your back pockets. You pull them down, okay? Then you're going to be pushing your butt back, moving your pelvis down or hips down, okay? And you're just hinging, pushing the hips back. You could have soft knees, okay? And you make sure that you're in a straight line. Now, another mistake I see people making is that they will go past their range of motion, which all of a sudden they'll be here, and then they'll start going further down. Oh, I have to go all the way to the floor. You do not have to go all the way to the floor. You have to make sure that you're not bending your back, and the range of motion will come. Now, this is the lowest, let's say, I can go, okay? And now, this is good. So now, to come up, I'm going to be using my glutes. Now, I'm going to squeeze my glutes at the top in order to come to the top. You're going to be engaging your glutes. A lot of times, what I see people make a mistake is they go down, right? And when they come up, they're like, well, I'm going to use my lower back, and they arch, okay? And you're causing a lot of stress to your lower back. You're going to get hurt. Another way to get hurt. So again, you go down, make sure your head is in line, tuck your shoulders back, chest up, okay, push your hips back, pushing through the heels. You don't want to be on the toes. Another common mistake I see people make, people come up on the toes. You push through your heels to help engage the hamstrings. So you go down, push the hips back and down, and then let's say this is the lowest I can go, and then you push through the glutes, squeeze the glutes to the top, and that's the top position. Now, there are going to be cues that help you get the movement correctly, okay? This is a dowel, a pole, you know, or just use a broomstick if you're at home, okay? So, what you're going to do is, you're going to put it against your back, and it should be staying in contact with 3 points of your body. Your head, the back of your head, in between your shoulder blades, and your lower back, okay? So you hold it over here, you hinge with the hips, and you come down, okay? Now, you'll know if you're bringing your head down, because all of a sudden it's not in contact with the head, right? And then you'll know if you bring your head up, all of a sudden it's not in contact with your shoulder blades, okay? You'll know if you're bending, because it's not in contact with your butt, and then you'll know if you'll arch, because it's not in contact with your lower spine. So this is a great tool to use. You're going to hinge, make sure it's in contact with all 3 points. Come up, squeeze, still in contact, okay? The next tool that or a technique to use is you go about 6 inches in front of a wall. You're just going to be using the wall to touch your butt. Okay? Just lightly touch your butt against the wall, and then that's good. If you're using your lower back, you're not going to be touching the wall. If you use your knees, again, you're not going to be using the wall. So you push your hips back, your butt back, touch the wall lightly, come up. It'll help you use that cue to help you make sure to use your hips rather than something else. Okay, another one is to put your hands over here in the creases of your pelvis, and you're going to feel them getting closed in from your hips, okay? So you're going to be shoulder blades back, head up, feel the crease, touch the wall, okay? And you'll feel it when you're squeezing your hands, okay? So that is the correct movement, common mistakes people make, and cues to use in order to get the hip hinge down. Thank you for watching my channel. Please like and subscribe. I'll see you next time.